Collection and Preservation of Urine lecture. The physiology of urine formation. Urine is formed through a filtration mechanism in the kidney via the nephrons. It is stored in the bladder and voided through the urethra. Obtaining a urine specimen, so proper collection is essential. You also need knowledge of the most common urine collection procedures. And careful labeling of specimens is very important. Different containers that we use in the collection of urine are non-sterile urine cups for random specimens and general urinalysis. Sterile urine cups, usually used for urine cultures or when we suspect a urinary tract infection or any type of infection. And urine bottles, which are 24-hour collection containers that are usually brown in color and quite large. So labeling containers. Labels must go on the container and not on the lid, and some facilities will put a label on both of them. On the label, you must have the patient's last name and first name, date of birth, date and collection time, and the time of collection, the type of collection, so if it was a midstream clean catch or a random urine, and the collector's initials, so your initials. So here's an example of a 24-hour urine label. So the patient's name, the test requested, the preservatives that are included in the 24-hour urine, who they were added by, when the test was began, so what time, and then the date, and the end time and date. Sometimes some patients will need more than one container for their 24-hour urine collection. So if it's the first container, it would be 1 of 2, and if it's the second container, it would be 2 of 2. So types of urine specimens. Random urine specimens, most commonly collected urine specimen, and the specimen obtained at any time of the day, regardless of if the patient was fasting or had anything to eat or drink. First morning specimens are preferred specimens for most urine tests, more concentrated, so a lot of times we like these for pregnancy tests, even urinary tract infections or suspected urinary tract infections. Drug screens are typically better with first morning specimens because the urine is less diluted and more concentrated. Drug testing urine specimens and 24-hour urine specimens. A clean catch midstream is the most common collection method. Proper collection is necessary to avoid contamination and ensure the urine components do not decompose before testing. Catheter collection, sometimes we will insert a catheter to get that totally sterile collection. And a suprapubic aspiration, which sometimes will be used where we take a needle and puncture the bladder and aspirate the urine from the bladder. And the whole purpose of getting the clean catch midstream is to evaluate whether any bacteria is present. If it's not a clean catch midstream, bacteria may be present from the outer orifices of the urinary tract. This can make it hard to determine whether bacteria was normal flora or if it is a pathogenic bacteria. We also will culture these types of specimens, and when we say cultured, we are looking and identifying microorganisms that are present. The midstream clean catch technique for bacterial culture and preferably for routine urinalysis. So you want to cleanse the exterior genitalia area with mild antiseptics or soap and water. A lot of times we will explain, and even in some textbooks you will explain to a patient to spread the labia. Using the term labia, they might not understand what that means. So you might want to use simpler terms for some patients that might not understand by saying spread the lips of the genital area, and they might understand that. So cleanse the area of the external genitalia with mild antiseptic soap and water. So spread the lips of the labia, and then you will take one towelette and wipe on one side of the labia front to back, on the other side of the labia front to back, and then one wipe specifically down the middle from front to back. The patient will then void the first part of the specimen into the toilet and then collect the middle portion of the sample. And the reason for voiding the first part is to cleanse the urethra of any bacteria that may be lying within inside of it. The patient then voids the remainder of the urine into the toilet. There are specific collection devices that we can use for infants, because obviously infants cannot have the same instructions as an adult or an adolescent child. So we will sometimes use what's called wee bags, and they look different in shape and size, but this is the general concept. There is an area of adhesive here and then a bag. This adhesive goes on the outside of the genitalia. You want to make sure the genitalia gets in the center here. And what you will want to do is cleanse the genitalia area first, remove the adhesive backing, and then put this over the genitalia. And a lot of times with infants, we'll put the diaper right over it, wait for the child to urinate, and then the parent will return the urine specimen back to the clinic. Other types of urine collection, sometimes elderly have a hard time getting urine specimens into a cup. So we will sometimes use urine hats, which have a quantity on them. If we are looking for a quantitative urine, we would do this part. We oftentimes do this in the hospital, not so much in the clinic setting. This is not a sterile container, so if a patient goes into the hat, then this would be non-sterile. It's not particularly good to use this collection method for a clean catch midstream. Some physicians will do this method and still order the urine culture. However, it's really physician preference in what they would like their patients to do. So it's important to check with your physician. However, if it's a non-sterile, if it's a random urine catch, you could use a hat for those elderly people. So if you have an elderly person and you have to get a midstream clean catch, catheterization is the alternative. It is collected by the doctor or nurse under a sterile condition. The catheter is a hollow tube that is passed through the urethra into the bladder. Specimens usually used for bacterial culture because there is less chance of external contamination of specimen, and the risk can introduce bacteria into the bladder and cause infection. Suprapubic Aspirate, which is collected by the doctor or nurse under a sterile condition. The exterior wall of the abdomen over the bladder is cleansed, then the urine is aspirated out of the bladder with a needle and syringe. Specimen is usually used for bacterial culture, and we use this on babies, pregnant women, and very obese individuals. 24-hour collection provide patient with both written and verbal instructions. Collection containers, hats, and other collection assistance devices. You must contain all urine patient voids within a 24-hour period, so instructions are really important. Typical instructions for a 24-hour urine collection are: the patient wakes up in the morning, they void their first urine into the toilet, they record the time, they collect all the urine for 24 hours after, and they refrigerate the specimen in between each urination. If the specimen urine is not collected during this 24-hour period, the whole process will need to be repeated. And then upon waking up the next day, the first urination of that day would go into the jug as the last specimen. And then it is important to instruct patients to return these specimens to the clinic as soon as possible. Typically, we like them the same day, so the urine parts and electrolytes are not compromised, because as time goes on, the urine quality is not as quality as right away when it's first excreted. So here is an example of what a 24-hour urine collection container looks like. In 24-hour or timed urine specimens, so again, preservatives and refrigeration of time samples, patients should be instructed about the hazards of preservatives. So patients should not touch the insides of the 24-hour urine containers. 24-hour timed collection procedure, first morning specimen is discarded, or first sample of time test. Test begins with an empty bladder and the last specimen is kept. Preparation of the final sample for transport, making sure that the lid is properly secured tightly. Drug screens, typically used for a chain of custody forms, job applicants, athletic events, suspected abusers, CDL license, etc. Random specimen is used with documentation guaranteeing the credibility of the collection. You need a photo ID when the patient shows up. We use a special collection kit. The bathroom needs to be inspected prior to putting the patient in there. The water needs to be turned off in the bathroom. Urine temperature needs to be monitored. So after the patient has voided and given you that sample, you need to record the temperature in which it has, and there's a little temperature reading label on the side of the urine cup. And then what happens is we usually seal the urine cup, and then we place a piece of tape over the top, and we have the patient put the date and time and then their signature that it is their specimen. Many facilities make patients sign specimens after being sealed with paraffin. So paraffin is what we use to seal the tops of them. And a lot of times with drug screens for suspected abusers, many physicians will only give them a certain period of time to go give a urine sample. So time is really important to record on these. And because some suspected abusers will wait until they absolutely have to go in and give a urine sample. So it is important to record that time in military time and follow the protocol to make sure there are no hiccups in the collection system. Because sometimes these cases can go into a court of law of whether the collection was done properly and those sorts of things, and a case can be thrown out if we do not collect it properly. Handling. Urine specimens should be kept refrigerated and should be processed within 2 hours of collection. Culture and sensitivity tests should be performed within 72 hours. A lot of physicians will wait for the urine dipstick or the urine analyzer to come back and those results to come back before they will order the culture and sensitivity testing. So a lot of times we will what's called UHAV, where they have the urine specimen on hold just in case we do need that culture and sensitivity. Refrigeration and preservation of urine. If urine sits at room temperature for 1 hour, bacteria will be present and will increase rapidly. There will be changes in the urine pH. Cellular elements can deteriorate and casts can decompose. You can also have an increase in crystals present. Refrigeration preserves urine for urinalysis and urine cultures. Make sure preservatives, if you are going to use any, if you can't get it to the lab in that amount of time, do not interfere with the tests. However, a lot of them do interfere with the culture. So if you are doing a culture and sensitivity on a urine specimen, we cannot use any preservatives. Chemical preservatives may be used when specimens can't be refrigerated for a certain urine chemistry test. Some examples of some chemical preservatives are hydrochloric acid, boric acid, acetic acid, and toluene. No preservatives can be added to specimens for culture again, so that is really, really important. And 24-hour preservatives are added prior to the start of collection. So if you're doing a 24-hour urine, that has to be added before you give the container to the patient. Changes in unpreserved urine. So there is an increase in bacteria, protein, nitrites, pH, and crystals. And there is a decrease in glucose because bacteria eat it. Ketones evaporate. Bilirubin and urobilinogen are affected by light. And red blood cells and casts are affected by bacteria and the pH, especially in alkaline urine. And also you can see some changes in color or turbidity. Some will become hazy as blood cells and casts are broken up. Work by limiting bacterial growth. Refrigeration all urine should be refrigerated at 36 to 38 degrees Fahrenheit, which is the most desirable. It prevents bacterial growth for 24 hours. Refrigeration can cause an increase in specific gravity due to condensation and precipitate amorphous crystals. You cannot so if you refrigerate a urine, you cannot dipstick the cold urine. You will have to have the urine sit out at room temperature for about an hour before you can do the dipstick, or the results will be inaccurate. Chemical preservation. If a specimen cannot be refrigerated, the goal is to prevent bacterial growth, inhibit urease, and preserve formed elements. Standard precautions observed when handling urine specimens. Discarded specimens go in the sink drain, followed by water and a disinfectant.